I'm going to reveal the precise blood pressure reading your body actually requires once you pass 70, and it's likely not the digit hanging on the poster inside your physician's examination room, not the measurement your wrist device flashes during restless sleep at 2 in the morning, not the value your specialist circles with ink and silently slides across the desk toward you. And I can demonstrate why every single one of those benchmarks fails a massive portion of the people monitoring them today. My name is Dr. Claire Whitman. I've worked as a cardiac surgeon for 2 decades, and I've spent 20 years with my fingers inside human chests, observing arterial force collapse on an operating display in actual time, watching precisely what unfolds inside a cerebrum, a renal system, a pair of lower limbs in the moments after that digit plunges too steeply and too rapidly. And I'm telling you plainly, most of what you've absorbed regarding arterial tension past 70 is fragmentary in a manner that is literally placing individuals flat on their bathroom tiles. The web overflows with rubbish concerning this topic. Grip your breath for 10 counts to drop it immediately. Roselle flower drink to eliminate hypertension permanently. Consume a single potassium-rich fruit daily to swap out your prescription pills. It's entirely worthless and worse than useless because none of it confronts the genuine hazard, which isn't even the one everyone's been conditioned to dread. Your vascular pressure is not a simple scoreboard digit where a smaller figure guarantees victory. That isn't how physiology operates. And the evidence backing this comes from watching what genuinely transpires inside a maturing circulatory network when an individual pursues a printed ideal without comprehending the machinery beneath it. When I evaluate a new individual in my office with a seated reading of 122/74, calm, at rest, that isolated figure communicates nearly nothing by itself. I must discover what unfolds inside that same body the immediate second they rise upright. I must determine whether their mind has quietly spent 30 years reconstructing its own operational foundation around an entirely distinct standard. I must investigate if the exact pharmaceutical mixture rendering that resting digit flawless is secretly starving their renal tissue or cardiac muscle simultaneously. This involves living tissue, not a spreadsheet. And if you genuinely want to decode your personal measurement, instead of simply submitting to it, grasping the underlying mechanics is mandatory. Because the instant you comprehend what's actually unfolding inside your conduits as the decades pass, you'll recognize the authentic menace for most individuals. Over 70 was never simply carrying an elevated measurement. It's possessing the incorrect pressure, driven at the incorrect velocity by somebody who never verified what happens the moment you leave the chair. Remain with me, because by the conclusion of this presentation, you will grasp exactly why the foremost clinical directives on this globe fail to align with one another, why the measurement safest for the person living beside you might prove hazardous inside your own frame, why tumbles and bone breaks among older adults are so frequently attributed to clumsiness, while the true culprit sat silently inside a pill container, and you'll comprehend the precise evaluation, the exact thresholds, the specific inquiries that disclose what your arterial force ought genuinely to be. Not as a generalization, but specifically inside your unique physiology. This isn't conjecture. This isn't a passing craze. This represents physiology, and it functions. But first, grasping what's genuinely transpiring inside an aging vascular network is essential, because without comprehending the machinery, formulating the correct questions proves impossible. Begin with your thinking organ. Your cerebrum refuses to passively tolerate whatever impulse your cardiac pump generates at any particular instant. It shields itself via a mechanism termed cerebral autoregulation, a pressure-governing apparatus maintaining cerebral perfusion remarkably constant across a broad spectrum of arterial tensions, irrespective of whether you're resting, agitated, or elevating yourself off a seat cushion. Here lies the element virtually nobody clarifies for those under care. That governing apparatus isn't permanently locked. Inside an individual who's existed with heightened vascular tension for 2 or 3 decades, the entire functional spectrum of that valve migrates upward. The mind accommodates. It reconstructs its personal description of ordinary around an elevated foundation. Drive that same individual's pressure downward abruptly, descending toward a digit that appears textbook flawless for a 30-year-old, and you risk dropping them beneath the basement. Their own cerebrum silently reconstructed itself around years prior without seeking consent. The measurement displayed on the armband resembles a triumph. The cerebral tissue remains undernourished the entire duration. Your renal organs function through a virtually identical arrangement, and this factor explains one of the most puzzling discoveries within the broadest arterial tension investigation ever executed. Kidneys hold their own intrinsic auto-governance, modifying force inside countless minute filtering structures so they sustain operation across a span of vascular tensions. A renal unit that has spent decades processing blood under an elevated foundation adjusts its inner tubing toward that baseline, precisely mirroring the cerebral pattern. Reduce the impulse nourishing that kidney too swiftly, and filtration capacity can tumble off an escarpment, not stemming from organ disease, but because the force it silently depended upon simply vanished out from underneath it. Now, let's examine the reflex tasked with intercepting all of this as it occurs, because this singular mechanism accounts for the majority of tumbles I observe entering my consultation space. Inside your throat and the curve of your primary vessel reside tension detectors labeled baroreceptors. They qualify as mechanoreceptors, indicating their function relies on physically detecting how extensively the conduit barrier stretches beneath them during each cardiac contraction. Upon standing, approximately 500 milliliters of your blood volume descends immediately into your lower limbs via gravitational pull. Inside a healthy youthful organism, those tension detectors register the decline in distension within 1 or 2 seconds and dispatch an impulse directly toward your brainstem, which answers through constricting your vessels and accelerating your cardiac pace just sufficiently to sustain upward cerebral flow. Here's the detail virtually nobody communicates. Those detectors perceive force by sensing stretch, and the conduit barrier they're embedded within rigidifies as the years accumulate. The identical stiffening pushing your upper measurement upward annually. A hardened barrier cannot distend as it formerly did. The detectors situated inside it grow numb. Not absent, numb. The tension decline upon rising arrives exactly according to schedule. The counterbalance shows up delayed, feeble, or occasionally not at all. That interval separating the descent from the correction represents the faint sensation immediately preceding a collapse. Occasionally, it is the collapse itself. This explains why the conventional method so frequently disappoints people past 70. Most clinical environments gauge arterial force precisely once while seated, following 20 minutes spent stationary inside a waiting area. And that single digit gets recorded inside the file as the complete reality concerning your vascular framework. If it exceeds the directive limit, pharmaceuticals get introduced or amplified. Difficulty resolved according to documentation, except it remains unresolved because that lone-seated measurement cannot reveal what unfolds inside the identical person 90 seconds afterward, standing beside the kitchen surface, extending toward a beverage mug, when the exact reflex designated to manage that shift has already numbed through decades of vascular hardening. The medication manages the record. It accomplishes nothing toward mending and can aggressively worsen the upright collapse no one inside that visit ever evaluated. And here's what's truly disturbing regarding how prevalent this genuinely is. Approximately 1 among 3 adults beyond 70 possesses a detectable clinically meaningful arterial force decline upon rising. Within institutionalized elderly populations, it surpasses 1 among 2. This isn't an infrequent side effect buried within a footnote somewhere. It sits near the standard condition of the aging circulatory framework, and inside a typical quarter-hour consultation, it goes almost never assessed. Roger had reached 74 years when he arrived to consult me, alert, still operating his vehicle everywhere, still ambulating 2 miles most dawns prior to eating. His arterial force had operated within the 150s across many years, substantially exceeding every current directive limit. A fresh clinician, adhering to the most recent recommendation precisely as printed upon the page, incorporated 2 supplementary pharmaceuticals to drive him beneath 130. 3 weeks afterward, his daughter telephoned me. He had collapsed inside his own cooking area, didn't stumble over any obstacle, didn't trip upon a floor covering. His lower limbs had simply ceased sustaining him for several heartbeats, and by the interval they recovered, he already occupied the flooring. We evaluated him horizontally initially, then upright. Horizontal, 122/74. Ideal. Flawless according to every chart throughout the land. Upright, half a minute afterward, 88/52. His cerebrum had spent decades functioning upon a loftier foundation. His baroreceptors were already dulled from the exact hardening progression we just traversed, and the 2 fresh pharmaceuticals had yanked the flooring out from beneath him the instant he rose upright. Meanwhile, his seated measurement appeared as an absolute victory. We didn't append a fresh diagnosis. We didn't dispatch him toward a specialist across the municipality. We reduced one among the 2 fresh pharmaceuticals and reassessed him upright, not merely seated, during his very subsequent appointment. Inside 14 days, the collapsing ceased entirely. According to documentation, under the freshest directive, his digits rested marginally above the target. Within his genuine kitchen, he no longer struck the flooring. 8 months afterward, we evaluated him correctly once more, seated and upright equally. Seated, 134/78. Upright at 60 seconds, 128/72. Upright at 3 minutes, 124/70. A mere 5-digit decline upon rising, comfortably resting inside the secure spectrum. 0 faintness, 0 incidents following that inaugural tumble. Roger's genuine secure measurement was never the digit printed upon the guideline placard. It was the digit his own organism revealed the instant he stood upright, and locating it required merely 2 additional minutes, alongside a tension cuff. Now, let's assemble this completely, because I intend to hand you the entire methodology, not ambiguous counsel like, discuss your arterial pressure with your clinician. This contains 4 components, and each component confronts a distinct mechanism we just walked through. Miss a single one, and you're only viewing a fragment of the image. The opening element involves the upright evaluation itself, because this represents the singular instrument exposing what a seated digit cannot. Sit calmly for 5 complete minutes, spine supported, soles flat upon the surface, forearm resting at cardiac height, and capture your reading. Subsequently, rise upright and capture it again at precisely 60 seconds, and once more at precisely 3 minutes. Inscribe all 3 digits during each occasion, not merely once, not merely when recollection strikes. Should your upper measurement descend 20 units or beyond, or your lower measurement descend 10 units or beyond at either the 60-second or 3-minute juncture, that constitutes a clinically meaningful decline upon rising, and it communicates more regarding your actual daily security than the seated digit ever shall by itself. The second element involves verifying whether you genuinely satisfy the clinical description of fragility, because fragility transforms the entire computation regarding how aggressively arterial force ought to be reduced, and it isn't a fuzzy term physicians casually fling around. It comprises 5 distinct quantifiable indicators: unintended body mass reduction, persistent weariness, diminished hand squeeze strength, reduced ambulation velocity, minimal bodily movement. Satisfying 3 or beyond among these 5 characterizes fragility within the investigative publications. And a 78-year-old who remains physically sturdy alongside a 78-year-old satisfying 3 among these 5 standards are not identical cases, even as a directive placard upon a clinic surface treats their birth records as the singular variable possessing significance. The third element entails a comprehensive prescription evaluation, particularly for substances dulling this reflex further, since particular classifications render an upright collapse drastically more probable. And should you or somebody you cherish ingest any among these, you require hearing this distinctly. Alpha receptor blockers, substances such as doxazosin or terazosin, frequently prescribed equally for prostate indications as for vascular tension, provoke a substantial standing reduction within up to 28% among older adults ingesting them. Beta receptor blockers, substances such as metoprolol and atenolol, transport beyond triple the hazard contrasted against not consuming one. Fluid expulsion agents, substances such as furosemide and hydrochlorothiazide, worsen the difficulty specifically later throughout the day, hours following their having already extracted liquid from the bloodstream, which explains why shifting that dosage earlier toward no later than mid-afternoon merits raising alongside your prescriber straightforwardly. Inside a single extensive group monitored over a mean period nearing 18 years, beyond 1/4 among participants ultimately endured a bone fracture, and the substances most powerfully connected were the very agents prescribed to safeguard their cardiac organs initially. The fourth element entails monitoring your diastolic floor, the lower digit, since virtually everyone fixates solely upon the upper digit, and virtually nobody observes this one closely sufficiently, and it potentially constitutes the most disregarded segment of the complete puzzle. Your cardiac organ's personal channels, the coronary conduits nourishing the cardiac muscle directly, primarily fill throughout the loosening stage of your cardiac cycle, the exact stage your lower digit quantifies. Inside a hardened, aged conduit, should that bottom digit become forced excessively low while medication busily chases the upper digit downward, the cardiac muscle risks ending undernourished, even as the upper digit appears flawlessly governed upon the record. Numerous investigations tracking older adults have discovered a diastolic force resting consistently beneath 70 associates, alongside additional cardiac occurrences, not diminished ones, which stands precisely contrary to what most individuals assume. That lower simply proves superior everywhere across the page. Beneath a certain foundation inside an aged conduit, lower translates towards starving the very organ the medication was intended to be shielding. That constitutes the complete methodology. Execute the upright evaluation. Examine the 5 fragility indicators truthfully. Scrutinize each medication upon that roster alongside your prescriber specifically regarding standing hazard and dosage scheduling. Monitor your diastolic basement, not merely your systolic ceiling. Perform all 4, not solely the single one feeling simplest, since a seated digit absent the remaining trio represents only 1/4 of the genuine portrait. Now, permit me to confront the counter-arguments, because I recognize precisely what certain individuals among you are pondering presently. Initial counter-argument: isn't diminished arterial force invariably preferable toward preventing cerebral events? Heightened vascular tension genuinely ranks as the single most alterable hazard element for cerebral events, and I am absolutely not instructing you to disregard an actual persistent elevated measurement positioned upon your record. I am informing you